20-year-old fever with 103 degrees Fahrenheit. Diffuse rash, 3-day control antiseptic nasal drop. Mechanics of action of toxin. Okay. Enhancement of phagocyte? No. There is antigen present by property. B or D. Polyclonal action of T cell activation. Variable regions of immunoglobulin known as variable as epitope, idiotope. Immunoglobulins for immunoglobulin is Each of the following act as surface immunoglobulin B cell. IgM, okay. 3-year-old serious pulmonary emphysema deficient in the case. Also, placebo. Sheath. Hip X-ray. એમાં આપણે શું જોવા મળશે? સેક્રોઇલિયાક જોઈન્ટ, ઇલિયમ, સેક્રમ, હેડ ઓફ ફીમર, ગ્રેટર ટ્રોકેન્ટર, obturator foramen, pelvic pubic symphysis, ischium, acetabulum, pubic symphysis, shaft of femur. Okay. તો shaft of femur અને neck of femur વચ્ચેનો એંગલ કેટલો હોવો જોઈએ? 120 થી ઓછો તો કોક્સા વેરા, 135 થી વધારે તો કોક્સા વલ્ગા. અને જે neck of femur અને ischium સાથે જોડાતી લાઈન હોય એને આપણે કહીએ છે sentence line. અને એક horizontal line બી જતી હોય છે એને આપણે બે ESIS ને જોડતી હોય એને કઈક કહેવાય છે, સેંગરન્સ લાઈન અથવા lower border of supramus lateral towards the head of and neck of femur. So center lines will be seen for fracture of hip joint. Coxa vera or limb lunging. Okay, higher trochanter it cause limb strengthening. Below the special test for hip is a Trendelenburg test to assess Trendelenburg unit. To assess the Trendelenburg unit. Trendelenburg unit. To assess the Trendelenburg unit, abductors of hip. એમાં હવે gluteus medius, tensor fascia lata અને standing pathological site. Okay. એમાં કેમાં superior gluteal nerve affected limb. Sign positive when made to stand on affected limb. Pelvic sags on healthy side. Leg raising test. Thomas Tracy's calls as leg raising test. Causes flexion contracture or flexion deformity of hip. Flexion contracture or flexion deformity of hip. Posterior dislocation of hip. It is a failure. Failure means flexion, adduction, and internal rotation. Failure in a posterior dislocation. Failure in anterior abduction and internal external rotation in internally rotated, externally rotated, and limb shortening in posterior dislocation, limb lengthening in anterior dislocation. Okay, posterior dislocation, senton line is broken, anterior. Okay, abduction and internal rotation. Okay, abduction and internal rotation. This is abduction external rotation, sorry, abduction and external rotation, abduction internal rotation, posterior dislocation of hip. Lesser trochanter is not viable. Head is palpable in gluteal region. Head is palpable in femoral triangle. Management, it is close reduction and not reducing due to the muscle spasm. Close reduction under the anesthesia. No reduction, we do open reduction. First we try to do close reduction. If close reduction do not occur under anesthesia or no reduction happen, we do open reduction. Complication of dislocation of hip. Avascular necrosis, most common in a posterior head dislocation. Proximal femur fracture. Okay, proximal head of femur fracture. Head of femur, intracapsular neck, extracapsular neck. Okay, three types. First is head of femur, either intracapsular or extracapsular neck femur. Acetabulum, that is head of femur. Head of femur is, yeah. Is the chances of avascular necrosis. The artery whose supply is the greater tubercle and it is the part of femur and medial femur goes along with it. Neck of femur or intracapsular fracture or extracapsular, different between both. The neck of femur occurs in 50 to 60 years. Intertrochanteric fracture occurs in 70 to 80 years. Female greater than males, female greater than male. Trauma due to the trivial fall, the moderate to severe fall. Pain is mild pain. There is moderate to severe pain. Location of pain. Shortening less than 1 inch. Extra capture of neck fracture. Deformity. External rotation. Less than 45. External rotation greater than 45. Avascular necrosis greater than non-union. Malunion. Coxa vera. Decrease in extra blood supply. Extracapsular fracture. Extracapsular joint. This is a intracapsule. This is a inside the capsule. It is a centon lines is broken. There is also centon lines is broken. Okay, there is three types: anatomical, Powell's, and garden based on disruption of trabecular ligament. Subcapital, transcervical, basicervical. Subcapital, transcervical, basicervical. Cervical. Subcapital, transcervical, basicervical. Type 1, type 2, type 3. Less than 60 to 65 age of fracture. Less than 3 weeks, close reduction. There is reducing the fracture in closed environment. Close reduction with internal fixation. And for greater than 3 weeks. Age of fracture greater than fix plus vascularization and placement. We are doing hemiarthroplasty in previously known like osteoarthritis of hip. Total arthroplasty, replacement of replacement, hemi replacement. We use the Thompson implant, Austin Moore implant, and bipolar implant. Most commonly used is bipolar implant. There is one acetabulum, sorry, connecting the neck of femur to the this shaft part. And Austin Moore, it's like have stainless steel ball with the body, and that uh, Thompson prosthesis, it has body. Intertrochanteric fracture management, surgical management. Vera is head and neck. Is less nail with locking and stabilize. If it is the intertrochanteric, this is the external neck of femur fracture. Neck of femur fracture classification: anatomical, subcapital, transcervical, basicervical. Near the capitulum, it is a subcapital. Below, somewhat below capital, a horizontal line just above the neck of. This is less than 13 degrees, a type 1. It is a greater than 30 to 50 degree, which is a subtranscervical. Type 2, greater than 15 degrees, is type 3. Okay. And garden classification based on disruption of trabecular alignment. Proximal nail with stabilizing screw, surgical management. Derotation, we use derotation. Like allows healing in malunited position, prevents the external rotation. Okay, we use derotation boot. This cards shaft of femur factor less than 6 months. We use age less than 6 months. Pelvic herniation. This is a gallows traction. 5 to 10 years. We use flexible nails, plates if unstable. Greater than 10 years. Intramedullary locking nails. Okay, most commonly used in children less than 2 years. Followed by casting. Intramedullary interlocking nails. Adults. Hashtag sharp of femur. Clinical picture not seen in the children. Or periumbilical region. Neurological symptom, confusion and disoriented. It occurs 24 to 48 hours after the insult or after the periumbilical. And neurological symptom like confusion and disorientation. Diagnostic criteria for this is GERDS criteria. Okay. Prevention, immobilization plus early fixation of treatment is suppressive oxygen therapy and intermittent positive pressure ventilation. Patella fracture, history of direct trauma to me. Patella fracture is history of direct trauma. Diagnosis, tension band wagon. There is physiological thing like patella has a two look. Biparated patella, congenital anomaly, accessory ossification center. Small separated fragment due to the incompletely fused patella at supralateral pole. Incidental 50% case. We are doing tendon bearing cast. Okay, patellar tendon bearing cast. Definitive force reduction plus internal fixation with intramedullary rod slash snare plus interlocking screws. Patellar tendon bearing cast. Definitive treatment cause reduction internal fixation with intramedullary rod plus shaft tibia fibular shaft fracture, intramedullary nail with screws, patellar tendon bearing cast, ankle anatomy, medial malleolus. First we see medial malleolus there below the bone. First bone comes the talus. This is the calcaneal. This is talus. This is calcaneum. There above this navicular. Calcanea, talo, calcaneal, navicular. Mortis view. Mortis view is seen is best for seeing the ankle. Okay, full ankle space joint. Deformity, equinus deformity. It is called as plantar flexion of ankle joint. Varus is inversion, eversion is a subtalar joint. Okay, varus and valgus. Varus and valgus of subtalar joint. Varus and ankle fracture. Isolated lateral malleolus fracture. Bilamellar lamellar Pott's fracture. Trilamellar, it is called as Cotton's fracture. Isolated malleolus fracture. Bilateral, the lateral malleolus and medial malleolus, both fracture. It is called as Pott's fracture. You should see bones. Okay, this is a fibula, this is tibia, this is a talus. Okay, this is talus. You see there is a fracture of malleolus. This is lateral malleolus. There is fracture of this lateral malleolus, lateral medial malleolus. No fracture of talus joint. This is the or cotton fracture. Bimalleolar slash plots fracture. What is the measure? First we will do is reduction. We will reduce the fracture first. Close reduction. Neovascular assessment we will do before and after. What we are doing? We are seeing for neurovascular deficit or compartment syndrome and doing the definitive surgery after the. What are we do for compartment syndrome? We treatment for compartment syndrome is fasciotomy. Fall from height on foot. Okay, you are falling from height from foot. There is two angles, Bohler's angle and Giesen's angle. They are for calcaneal fractures. First, Giesen's angle is this is from talus. You are doing the line, posterior facet. We are doing line, and we are line is this navicular bone. We are doing this is the angle is Bohler angle. We are creating the line. Okay. This is a Giessen angle. Giessen angle is more, and we are seeing aviator's fracture risk of avascular. There is a body of talus. Third, avascular necrosis. Hawkins classification used for aviator fracture. Aviator fracture, Hawkins fracture. What are we use classification for neck of femur fracture? First is angle classification. There is angle of neck of femur. This is a Powell's classification. Sorry, Powell's classification, guidance classification, and anatomical classification. Okay, subcapital. Bohler's angle, Gillen's angle. Aviator fracture, fracture of stellar of neck, increase risk of avascular necrosis of body of talus, lead to subtalar arthritis, Hawkins classification of talus, neck fracture, blood supply of talus, dorsalis pleuris, and sinus tarsi artery. Okay, dorsalis pleuris, talus, fracture from talus is a Chopard. This is cuboid, knee, Liz Frank. Here, Claire, and above the hidden hinds, fracture of intertarsal joint, Chopard's fracture. This fracture, fracture of fifth metatarsal, metaphyseal, diaphyseal, decrease vascularity and fixation. Non-weight bearing short leg, cast for 6 to 8 weeks. Intramedullary screw fixation. Common nerve injury, hip dislocation of the sciatic nerve. Neck of fibula fracture, common peroneal nerve. Okay. Hip dislocation, sciatic nerve, neck of fibula fracture, common peroneal nerve. With this. You will add the things that are necessary, that are important, and not add the unnecessary things. Okay? Pen. We need. Okay, this is Perkins line. Vertical line. Horizontal line is Hellingerian angle with its this line below is called a sentence line. Graphs classification: alpha angles decrease, beta angle increase, normal hip joint, humeral okay. Close reduction followed by pelvic organ system. I think I had to add some. There's something like press pelvic organ. So close reduction by pelvic harness. 6 months to 5 years. So 6 months to 5 years. What are they doing? Hip spica cast. Hip is then gallows traction. Gallows traction. This is a pelvic harness. So aware we are doing. Less than 6 months. No, Theo. Hi. flexible, okay, intramedullary, yeah, 2 years old, intramedullary interlocking nerve. Actually grinding the scoliosis is the McMurray step. Here and here. Order, order. Shortening cardiac step. Now, cardiac TBI, patella flexion bend wiring KY. Anatomy super test. Okay, patella tendon bearing cast. Biparietal patella, glass patella, include fracture. Bumper step. We have seen what. Commitment for sale. To get lateral Young and Burgess for plug. Osteoporosis. Tibia fibula elastic ligament. Rolling moderate next periprocontric functional lytic greater than 2/3. The neural stress the front fracture is a sprung fracture. Chopard is intertarsal. Uh, metatarsal. Common nerve injuries, hip dislocation, sciatica. Non-weight bearing short leg. The multi okay. More a more. Mhm. Commonly used. Okay. Mhm. Now, sciatic nerve. Epislogranoma, sciatic nerve. Neck of fibroma, CPN. Common esophagus. Oh, surgery. Gastrointestinal. Yes, I want to know. I am bad at it. Gastrointestinal. Okay. Surgical anatomy. A narrowest part of GIT. Frontal must face of coin देखा. It means esophagus. Frontal you can see face of coin. Okay. In the lateral side of coin esophagus. Frontal side of coin can say double ring sign button battery. Okay. Next impacted cystic endoscopic removal. Button battery endoscopic due to alkali penetrate differ or this liquid has a manifestation. Zagar's classification. What is this? Is alkaline injection. For example, no role of prophylactic antibiotic early esophagiotomy. Yes, this is a type of esophageal. Okay, first A esophageal trachea there is big gap. Is a type isolated E of esophagus isolated esophagus. If upper part not touching trachea, lower part of a proximal part, distal part is tracheoesophageal. TEF. After the distal part has TEF, sorry, proximal part has TEF, it's a B. Distal part has TEF, it's a type C. Both have TEF, it's a type D. And type is of conjointed and TEF. It is not different. Singular is a type E esophageal atresia. Okay. Ectoesophageal fistula you can type. So can divide upon respiratory distress, excessive drooling of saliva, coiling of orogastric tube, and rule out the vectoral anomalies. Vectoral anomalies are vertebral defect, anorectal malformation, rectoesophageal atresia, fistula, renal abnormality, limb defects, cardiac abnormalities. Okay, vectoral defect. Contrasting conformity iohexol gain greater than dinosine. We use dinosine because it's a non-iodinated. If your kidney function is impaired, sorry, renal function is impaired, combined tracheoesophageal investigation charge for H type. E or H. Okay. Patent esophagus. If esophagus is patent and there is atresia, tracheoesophageal fistula. Waters and criteria for anastomos. Type 2 and are close. Anastomosis 2 and far gastrotomy. Anastomosis where close are close. BCDE posterolateral thoracotomy. Posterolateral thoracotomy. First 2 and are close anastomos. Far we are doing gastrostomy. Okay, gastrostomy and BCDE posterolateral thoracotomy. Posterolateral thoracotomy. I'm not doing anything else. Doing question. factor which maintain a lower esophageal patency. Length of intra-abdominal esophagus 3 to 5 centimeter normal. Less than 2 centimeter predisposition to GERD. Pinching effect of right diaphragmatic pleura. Orientation of gastroesophageal angle of his. Orientation of gastroesophageal angle of his. Arrangement of mucosal fold. Lower esophageal sphincter less than 6 mm Hg. It is called as GERD. Predisposing factor. Increased pharyngeus, lower esophageal sphincter relaxation is the early sign. Increase obesity, decrease H. pylori infection rate. Decrease H. pylori infection rate. Risk of Barrett's and adenocarcinoma. Increase risk of Barrett's and adenocarcinoma. Retrosternal burning sensation. Retrosternal burning sensation is a clinical picture. Water brass, pharyngitis, laryngitis, chronic cough, wheezing, dental caries. Retrosternal burning sensation, chronic cough, water brass, pharyngitis, laryngitis, uh, chronic cough, wheezing, dental caries. Okay, dental caries. Uh, 24-hour pH monitoring. 24-hour pH monitoring. For our pH monitoring. Endoscopy investigation of that. 24-hour pH monitoring, gold standard. Management is lifestyle changes, reducing the weight, small frequent meal, medical management, people with prokinetic, surgical management, fundoplication. Okay. Management, lifestyle, reduce weight, small frequent meal, management of pros, PPI, the prokinetic, surgical management, fundoplication. Not it's a complication of GERD. GERD associated with large arterial hernia. Patient want to stop medical management. Principle of fundoplication to restore adequate intra-abdominal length, minimum 5 centimeter. Tighten the diaphragmatic pleura. Wrap fundus around the esophagus. Preserve vagus nerves. Re-establish angle of his. Type of fundoplication. Complete wrap, Nissan 360-degree, most common. Gas blood syndrome, it's the most common. First we see Nissan fundoply, 360-degree. And please we see a question. It's a question mark common. I think please guess first. Pipette Beasley is a 270 centimeter degree anterior. 360-degree Nissan fundoplex. Pipette 180 to 270 degrees. Beasley's mark is a 270-degree. And polysaccharide create a neoesophagus. Respiration of lion. Polymer injection, high recurrence rate. Endoscopy are good long-term result. Magnetic sphincter endoscopy radio ablation and magnetic sphincter augmentation in a patient with minimal or no hiatal hernia. Barrett's esophagus, a specialized intestinal metaplasia, squamous columnar epithelium, red velvety mucosa, increased risk of adenocarcinoma, endoscopic biopsy, gallbladder cell, pathognomonic. This is a pathognomonic. Okay. Investigation, endoscopic, biopsy, gallbladder cell. It's a pathognomonic. Chromo endoscopy for microscopic environment, methylene blue for Barrett, glucose iodine for squamous cell carcinoma. Glucose iodine for squamous cell carcinoma. Uh, long segment catheterization, short segment lesion, cardiac metaplasia, microscopic. Paraxium criteria. Okay. What? Barrett's esophagus, Barrett's endoscopy, goblet cell. If you see goblet cell in a stomach, esophagus, it's the pathognomic of Barrett's esophagus. Methylene blue is used for Barrett's. Barrett's methylene blue and leukocytin for subcellular carcinoma. We can see this is the HP. We can see this cells, blood cells, and different. This is the metaplasia. Increase the chance of adenocarcinoma of stomach. Does not increase the risk of subcellular carcinoma, sorry, squamous cell carcinoma, or any other carcinoma. Okay. Long segment short segment cardiac metaplasia micro. Parag C and M criteria. It is for gastroesophageal. Okay, this is our carcinoma of stomach. Maximum extent, circumferential extent. 0, 2, 4, 6, 8, 10, 20. Seattle protocol for coordinate biopsy every 2 centimeters, targeted biopsy, microscopic lesion, no dysplasia. Repeat OGD every 3 to 5. Low grade dysplasia, endoscopic ablation. 6 months until 2 consecutive non-dysplastic biopsy. High grade dysplasia, therapeutic discovery. Esophageal cancer, squamous cancer, adenocarcinoma. Most common oval one, most common in Western world is getting a middle one third, lower one third is left. Smoking, alcohol, risk factors are smoking, alcohol, preservative-rich food, smoked food, tylosis, achalasia cardia, Zenker trafficum, corrosive injury, pearl or such. Smoking, alcohol, GERD, Rest syndrome, um, Barrett's esophagus and obesity. Barrett's esophagus, obesity. Okay, Barrett's esophagus, obesity. Progressive dysphagia, weight loss, hoarseness, signs of advanced disease. Left recurrent laryngeal nerve. Endoscopic biopsy, investigation of choice. PET CT, investigation of choice for F18 FDG or shouldering effect. Red tail appearance. Endoscopic USG, investigation for choice or T staging. Barium swallow, red tail appearance. Barium swallow, red tail. Endoscopic biopsy, investigation of choice. PET CT, investigation staging. FD, F18 PUFD. Barium swallow, red tail appearance. Barium swallow, soldering after red tail appearance. Barium swallow. Sievert's classification minus 2 centimeter in a minor. Type 1 is the proximal area of 1 to 5 centimeter is the type 2. And 1 to minus 2 centimeter. The G junction, that is gastro below 2 centimeter, above 1 centimeter, type 2, 2 to 5 centimeter below the type 3 is a gastroesophageal carcinoma. In a F18 FDG PET CT and endoscopic USG investigation of T staging, not tumor staging, endoscopic USG. Red tail appearance you can see in barium swallow, esophageal carcinoma, red tail appearance. Barium swallow, red tail appearance. Margin proximal gastric tube based on right gastroesophageal cut. Greater than right gastric cut. Okay. We are putting on right gastroesophageal activity. Greater than right. Jejunum column if stomach is affected. Seems self-expanding metallic stent. Usual magnetic. Tracheotomy margin proximal 10 cm, distal 5 cm, or lymph node 15. Minimal lymph node 15. 1 5. Jejunum colon. Stomach affected. Self-expanding metallic and tracheoesophageal fistula. Common benign tumor type I just looks like tadpole type esophagus. Barium will patch out of it. Enucleation using submucosal tunneling, tunneling endoscopic resection. Most common binary means enucleation using submucosal tunneling endoscopic resection. Cricopharyngium चलते हैं. This is clear days. What I said, hyropharyngeus and cric. Hyro and cricopharyngeus. Due to injury, this is a true diabetic. Okay, generally true diabetic. All right. Becker is a false diabetic. Only mucosa is come out. Position posterior midline, start left to midline. The finding. Clinical halitosis, aspirational pneumonitis is the barium swallow. Management is directly on plus ecopharyngeal higher type 2 rolling higher. Yes, stomach portion thoracic cavity is normal. Third, asymptomatic, not life threatening. Chance of volvulus and necrosis. Most barium swallow. Stomach portion thoracic cavity sliding plus both of them they post and side upper one chest abdominal pain post and small perforation plus stable fluid diabetic and sepsis sinus perforation is called as Bohr syndrome. Forceful vomiting occurs follows otitis. Seen in spontaneous we are calling it the Bohr have syndrome. Bohr house syndrome. Most common is lower one third of left posterior lateral wall. Left most common lower one third left posterior wall. Macular tract. Subcutaneous emphysema, retching, chest pain. Harmon's crunching sound or heart oscillation. Okay, Macular tract. Split in mucosa and submucosa. Okay. Syndrome is the emphysema, retching, chest pain. Emphysema, chest pain. Crunching sound on heart oscillation. Harmon's crunch. Stable patient GST contrast study, X-ray pneumodynamism, Neclerio V sign. This is Neclerio V sign. Okay, V looking chest one side. Continuous hemidiaphragm, ginkgo leaf. Does it look like a leaf? Seal perforation, adequate drainage, nutrition support. Endoscopic sealing with clips and subendoscopic mucosal septation. Uh, tubal placement. It is a type B ring, mucosal, submucosal. Interpretation is symptomatic cause dilation. Feline esophagus is a esophageal esophagitis. Gastrointestinal lower one third, esophageal is upper one. It is seen in upper one. Upper one third is seen esophageal esophagitis, chronic immune antigen mediated disease. Would peak age is 20 to 30 years. Endoscopic rings greater than 15 years and HPF. High power fluid greater than or equal to 15 and high power fluid is a biopsy. Okay, PPI inhibitor. Okay, the goal is increasing eosinophil. Esophageal infection, esophageal canal, oral ulcer, bomb-like ulcer and saggy appeal. Cytomegalovirus is a serpiginous ulcer, worm-like ulcer, esophageal canal. Okay, small with raised margins, herpes labialis. Chalgia cardia is a mortality barrier of lower esophageal sphincter to release is a Achalgia cardia. Achalgia cardia, lower esophageal sphincter to release, primary Achalgia